With my dad being a doctor, I could get an appointment or medication or whatever I wanted, whenever I wanted. I didn't have to deal with setting up appointments and going through the bureaucracy of healthcare. So in the last 2 years, I've had to have my own insurance, which I guess it's interesting because I was kind of not in the real world in terms of health insurance. And the doctor's perspective, healthcare is a little bit different than I think the patient's perspective, because the doctor's perspective is that they're not being reimbursed as much as they used to. You know, you're taking into account the cost of inflation, you're taking into account your business expenses, your malpractice insurance and all that. You're just making less and less, and your cost of practice is going up and up. And so there's this fine line of having things cheap enough that everyone, you know, universal healthcare that people can afford, but also at the same time, you know, you need to adequately reimburse the doctors that, you know, do a lot of training and go through a lot of hard work to be able to treat patients. The government would have to talk to the insurance companies more than the doctors per se, because the insurance companies are really the ones that dictate the prices of how much the doctors need to charge and how much the patients need to pay. So I think you need to work more with the insurance companies more than the doctor. But I mean, no doctor goes into medicine to become rich anymore. It's just not the way it is. It's just, but at the same time, you know, you want to at least be able to support yourself and have a nice lifestyle. It definitely shows you that me at the medical student level, I don't really know a whole lot about it. And I bet you if you ask a lot of other medical students, they're probably not going to know a lot about it either. And I guess it's just one of those things that comes with time and practice. But I'm sure it would have been nice for us to kind of have a heads up to learn in med school some of these things so we're better prepared in the future.